The chair will next call case number 00888654 Washburn Avenue. Is anyone interested in this matter? That says innocently.
Is there anybody here interested in Brookline Street? I think they,
Oh, that's a good point. They'll go. Is there anyone here interested? We have some cases later on our agenda we're going to be continuing. And if people are here for those, you might, just to tell you, you can leave unless you want to wait around to hear the date for the continuance. There are 3 cases that we're not going to hear tonight that have been advertised for one reason or another. One is 008898 201 Brookline Street, number 6. A second is 008899 201 Brookline Street, number 5. And the third one is 008957 146 Mount Auburn Street. So any of those cases, if you're here interested in those, we're not going to be hearing them tonight. Thank you very much. The floor is yours.
Good evening. My name is Denise Chicoine. I'm an attorney for the North Charles Mental Health Research and Training Foundation, Incorporated. North Charles is here applying for a special permit. North Charles was founded as a behavioral health care services provider in 1971 and has always provided behavioral health care services in Cambridge since that time for over 40 years. North Charles is a well-known teaching facility affiliated with Harvard Medical School and the Cambridge City Hospital. The majority of the services that North Charles provides at the Washburn Avenue location are therapy sessions for individuals in recovery. This is conducted by licensed social workers, and the triggers of opiate addiction are discussed, and individuals are helped with how to manage their addiction. We are seeking a special permit.
So you just said the majority of what you do. What else you do?
Can people hear back there?
Yes, that's good.
Can you hear?
We'll do the best we can. This is a bad room.
Yeah.
If you want to move to the sides, feel free to move a chair or stand up or even sit behind us if you can hear
Or just
better.
speak a little louder
Yeah.
too.
So the vast majority of services provided are by licensed social workers and other clinicians in regard to therapy. There is an ancillary medical use where individuals, there's a medical director, and there are some assessments done because the program is affiliated with methadone dosing that is done only at Cambridge City Hospital. No medications are kept on site at the Washburn Avenue location. This site is a pre-existing non-conforming commercial use. And I'll just show you the layout. Sorry, these guys. So the first is to show you just a Google map. I have 3 of these. Sorry.
Okay, I'm pretty familiar with the property.
Okay. And that's to show you that Washburn Ave basically runs between Massachusetts Avenue in Cambridge and turns into Newbury Street in Somerville. So, and it runs perpendicular to Broadway. The building itself, as I said, has been now renovated to meet the needs of North Charles clientele.
Anybody else occupy the building? Or will occupy the building to grant you relief? Any other organization, other business?
No, this is the only tenant.
You'll be the
in
only
this
tenant. You'll
building.
be the sole tenant.
Yes.
Right.
And
Well, just to clarify too, I mean, there's administrative.
I'm sorry, you are?
Gary Houle, the executive director.
Gary.
Houle, Houle, of North Charles. Just to clarify, there are administrative and accounting services and things like the general administrative stuff that goes
We
on.
assume that, yeah.
Very.
this is just one more image of the building that's built out.
Is this the front door, if you will?
Yes,
And that is on the side of, okay, it's not
In the
directly on
parking
lot.
Washburn.
It's at
in
the
the parking
parking
It's in
lot,
the parking lot.
halfway down the building.
North Charles is seeking a special permit to be a nonprofit educational use, alternatively as a social service center, or an other healthcare facility.
Can I just interrupt you right there? I'm sorry I'm interrupting anyway, but I'm a little confused, and just help me. You said it could be one of 3 things.
Yes.
You've identified a moment. Nonprofit educational or other institutional use, healthcare facility, or social service center.
Yes.
If I look at the zoning ordinance, what is it, 4.56, it talks about a special permit for a healthcare facility, talks about a special permit, it's a right approach for a social service center. I could not find anything that deals with nonprofit, educational, or other institutional use. Where does that come from in terms of our ordinance?
I have that.
This question is
I
not...
believe it was generally taken from within section 4.50.
But then there's a table. There's a table in 4.56, and it's not in the
Yes.
table.
Oh,
I guess what I'm trying to get at is I don't think that's relevant. You're either a social service, a healthcare facility, or a social service center. And if you are either or both of those, we can grant you relief by means of a special permit, which is why you're here tonight. But under our ordinance, any use that's not identified is not permitted.
well,
So-
there is other institutional uses I'm looking at.
Where does that-
Letter H, 4. Institutional use not listed in any other category. I believe that was,
And the special permit, is that the relief that's required? What does it say in the table? I can get there myself, but save me this bother. I think I'm trying to, we'll be very careful about how we proceed in this from a legal point of view, and
yes, so in a business A2 district, that would require a special permit, the way I'm
you're
reading
not,
this
you're not
chart.
in the business A2 district. You're in a residential district.
Well, in residential, part of the, yes, so that definitely.
I think you should forget about calling yourself a educational or other institutional use. You rise and fall as you're either a healthcare facility or a social service center, and you say you're both, which is fine. And if that's the case, if you're one or the other, we can grant you relief by means of a special permit, should we choose. But I just don't want to muddy the waters with a category that's not covered by our ordinance, or at least a special permit relief that's not covered by our ordinance.
Oh, I understand what you're saying. So
Okay.
we have that basis
You-
there,
you-
but we'll
you-
focus on the other
Let's
points.
focus on the other points. Okay, thank you.
So North Charles meets the criteria for a special permit because it is consistent with the requirements of the ordinance. As everyone is aware, we are in the midst of an opiate addiction crisis, and treatment facilities such as this are critical. There are no other facilities performing these types of services in the Cambridge-Somerville area. Individuals in recovery do not create an inherent risk. These are functioning members of society who are Cambridge residents, who are Somerville residents, who come from other towns, who hold professional positions, and they come for treatment. The Washburn Avenue location is particularly advantageous because many of the individuals rely on public transportation. So this is close to the Red Line, this is within walking distance of bus lines, and the traffic generated, this is the second criteria, will not cause a congestion hazard or a substantial change. And I know there was much prior testimony about this in the fall, but I think it's important to note that the telecommunications company that previously occupied this building had 80 employees. North Charles has 30 employees.
You have 30? How about, do you have any consultants? Do you have other people? Just 30 employees?
Well, we have 39 employees, but not all at this site, only 30 at this site.
We're talking only about the site.
Yeah.
30 employees. What's your plan a year from now? Or if we granted you relief and things went well, how many would you have? I mean, I want to get a sense of how many.
It's a pretty static business.
Is it static business?
We have restrictions at Cambridge Hospital as far as the amount of, the number of patients we can see at Cambridge Hospital is restricted, so frankly, we can't increase the size of the business, not more than probably 5% at most on the outside, because of restrictions between the Line Street neighbors and Cambridge Hospital around our dosing site over there.
So you have
So
roughly a
it's
static
static,
number
it's a static,
in the
right.
30s. How many, on a typical day, how many, I don't, do you call them clients? You call them clients? Yeah, clients, okay? How many clients would visit your premises?
On a regular day, I would say approximately 30, 35, maybe 40
So-
on the outside.
Okay, let's say 35. So on any given day,
I have a question on this, you can finish it.
on any given day, in the day where I assume we're going to get to that a little bit, day being Monday to Friday,
Yes.
you have, the premises will be, at one time or another, will be occupied by 75 people roughly, coming in and going, maybe there all day, some,
No, because the patients are not, that number of patients that are clients that are there go from 7:30 in the morning till 7:30 at night. So it's a flow.
No, it's a
not-
flow.
Right.
I
it's
understand
not-
that. I didn't mean
It's
it's-
not at one, I didn't want you to think
no,
it's
no,
all
I
at
didn't
one
I didn't
time.
mean that, but at
That's
some
not-
point, one way or another, at some point
Yes.
during the day, 75 people roughly,
Right.
75 people are going to traipse in and out.
Yes, that's correct.
Okay, good.
So my question to this is, looking at the renovated floor plans in the file, I counted 25 group consult rooms that you built in the facility.
Individual consult.
Yes, 25 spaces, which says to me you could accommodate 25 clients at any
All at the
given
same
time.
time, yeah, theoretically all at the
Now,
same time.
how long does a session last?
No more than an hour.
Okay, so the number of people could be significant traveling through them.
Well, what I'm trying to get at is the traffic, because the number of people translates to how many people going, traipsing in and out of the
Just so you
building.
know, we have approximately probably about 325 clients at any given time. A lot of which are only seen once a month, or only seen monthly, because as you know, insurance only allows, because of insurance restrictions, they're only allowed one visit a month. There are a number of patients that are seen weekly. There are a number of patients that are seen for a group once a week and an individual once a week. So it's very hard for me to, because this all has to do with treatment planning, it's very hard for me to estimate how many in say a week, how many visits, how many I understand what you're asking is, what's the coming and going, what the coming and going is.
Designed to accommodate, the way it's laid out is up to 25
Absolutely.
potential clients, patients at any given time,
Yeah.
at 1 hour increments.
Right, I
So there
agree,
could
yeah.
be a significant amount of traffic.
I mean, what happens is, our staff has given a caseload. They see approximately, they're assigned 28 patients, and that's over a 40-hour week. So, of those 20, it's complicated to get into this, but if 25 staff people each have 28 clients, they're not seeing them every week and over a 40-hour week. So the number of visits, I can get you the numbers. I mean, we could actually run that.
Well, I mean,
figure it out.
it goes-
But I mean, it's nowhere near, I don't think it's as much as you'd think. I mean,
Well, you've told us 45.
right, but I mean,
day,
it's not constant coming and going. I think what ends up happening is to be honest with you, most of the folks we see are working adults. The vast majority. So there's an active period between about 7:30 in the morning till about 10 o'clock, and then another very active period later in the afternoon, 4 to 6:30, 7 o'clock.
See, that's one of the problems I have with your
And during the day, there's frankly not a
Yeah,
lot
but
going
see,
on.
we're talking about a residential neighborhood, and what we have to do is balance
Right.
what you want to do and the very good things you do for the community and for society against the needs of the residential neighborhood. And this is a purely residential neighborhood. It is a narrow street, and there are children who live in the building, in many of the houses. They go to school in the morning, walk to school, drive to school. There are people who commute to work. So the busy time, for them, I have a lot of problems, frankly, with you doing business in the hours that kids would be going to school or people would be driving to work. I can see at the end of the day, staying open later, because by that time, if it's 6, 7 o'clock at night, the kids are home from school, hopefully, and most people have returned from work, or not. But it's the early morning hours I found very troublesome, frankly.
But there's nothing troublesome about these clients who are coming. These are individuals in treatment. They don't pose a threat to
It's
children
not a
in
matter
the
of,
neighborhood.
well, yeah, but it's just traffic. I mean, you've got a lot of people driving in, walking in, going up and down the street. It impacts the residential neighborhood and the kids going to school.
But a general office use could also, with 80 individuals, have traffic.
But
and
you're not a
pedestrian
general
use.
office use.
But that's what could be there as a matter of right. And
That's
then
right.
prior to the telecommunications company, there was a light manufacturing property, which there was loading and unloading of tractor-trailer trucks there. So this use is not more intensive than what could be allowed as a matter of right on this property. That is the contention that we have.
Well, we're not the owners,
I think-
obviously, we lease, I mean, there's a landlord.
I think it's important that you say that, but I also think it's important that you acknowledge that the room is full behind you, and that people are concerned, and that in the plans, it seems to me be really important to have had a lot of ways of addressing these concerns, rather than just trying to say that they're not, it's not a problem.
Well, I think the other thing, yeah, the other
It's
thing.
received as a problem by all
Right.
these
No, I
people.
understand, and I think, the other thing to remember too, there's a lot of our folks take public transportation, so there's walking that goes on. There's carpooling that goes on. I mean, I know the ride, it picks up a couple of folks, the MBTA ride drops off and picks up people in the mornings, and multiple, not just a single person. And so, I would have to say that I don't think the trips are excessive. I mean, well, I drive there every morning. I know, I drive there every morning. The traffic that's generated, frankly, by the high school parents dropping off their kids is way more than anything that we do, and there's obviously no problem with that. I mean, there's 20, 30 cars coming down that street at certain, at drop-off time, they're coming down, they drop off the kids at the high school.
What high school? I don't know the area that well. What high school? In Somerville?
Matt.
Over the line?
Matt
Young. Got it, thank you.
And they're dropping off at the high school and then driving, they drop off and drive down the street. So it does admittedly create quite a bit of traffic, it has nothing to do with us.
You said your hours of operation start at 7:30 in the morning?
Yes.
Your written materials you submitted said 7 in the morning.
Well, there's people, I just want to say, there's people, our employees show up at 7 to open the doors. So the secretary shows up at 7 o'clock before the patients show up. But I didn't want to kid anyone about when a human is actually in the building.
The client services are.
The client
From
services.
7:30 to 5, and then hours until 7, just 3 nights a week.
How many days off are you open? Is it-
5 days a week,
So Monday to Friday?
Monday through Friday.
No weekend hours?
An additional criteria for a special permit is whether adjacent uses would be adversely affected. And as we've been discussing, there are many diversified uses in this area. Out on Mass Ave, on the corner of Washburn, there's a Valvoline oil change station, there's a Bright Horizons early education and preschool, there's a Norton's liquor store directly adjacent to Bright Horizons. In short, there are a multitude of commercial businesses.
And not to be difficult, but any activities on Massachusetts Avenue are not relevant to what's going to go on Washburn Avenue.
Well, I'm just
that-
addressing the point.
Massachusetts Avenue is a commercial area, no
Yes.
question about it.
Yes.
But then we're talking about a residential area.
And also a portion of Washburn Ave, I would say, is zoned as business A2.
All right, then you can do it in the zoned area, but in the residential area where you want to locate your facility, there are no other activities other than residential.
Except that this is a pre-existing, non-conforming.
Not for the
commercial
use you
use.
want to put it to, though. We had this case before. What you're doing is not a pre-existing, non-conforming use. General offices, not your healthcare facility. They're not going to relitigate that case.
Right. Another criteria is whether this proposed use will create a nuisance or hazard or a detriment to the health, safety, and welfare of the citizens. And we submit that as a nonprofit educational organization with the goals of improving and maintaining mental health stability in the community at large, that this is a net benefit to the area. All of North Charles services are conducted within the building. They do not cause any disturbance to the surrounding residential citizens. There's a security guard that North Charles pays for 5 days a week. And
Where's this guard located? Within the building or
In the
outside?
parking lot.
In the parking lot.
And that is just as an extra assurance to the neighbors that there will not be any disturbances.
This was a request from the city manager that we have someone that directs traffic.
Just curious.
Just, I mean, I didn't want you to think that.
What about
you've got a
external
problem.
They had
lighting?
a problem, I was.
External lighting in the building?
There's LED,
I mean, you're not going to have neon, a sign, lit sign at 9 o'clock at night saying,
there's no signage.
none of that. It's just
There's no
maybe
independent signage.
on
Just
the building
On the
itself.
door, right. And the lighting was changed by the landlord, and whether they spoke to you folks, to somebody I do not know, but they installed low voltage LED lighting, down lighting on the exterior of the building that we frankly don't control, they do.
One of the issues that has been raised in the numerous letters that we've received, and I suspect we're going to hear orally, is waste disposal or littering of the streets or the neighborhood by your clients, I think was the word we used. How do you propose to deal with that? I mean, there are cigarette butts, there are coffee cups, there have been claims of even hypodermic needles, but I don't want to go there. But
Well, I don't think the hypodermic needle issue is valid.
I don't want to go there.
Let's not go there.
But I guess I think it's fair to say that many of your clients have addictive personalities. They're likely to smoke. They're likely to come in with,
Absolutely.
and they're likely to go on the way out, throw it on the street. I mean, what steps are you going to take, or will you take?
We have been taking, since we've moved in, we've had, and we reiterate this literally every 2 weeks at every group meeting we have, at any group meeting that occurs, that we have a cigarette butt disposal unit in front of the building. We have a trash can in front of the building. We've told every time that there's a group meeting, we explain to the patients to be good neighbors. Please do not dispose of any items in the streets. We encourage them not to drink anywhere in the neighborhood, not drink coffee, iced tea, Coke, etc., anywhere in the neighborhood. When they leave, to leave immediately, to exit to Mass Ave and beyond, do not hang around, do not loiter. Literally, we've done that every 2 weeks in every single group meeting. And I think, to be honest with you, the patient population is extremely, extremely concerned, to be honest, that they're being stigmatized and that they claim that they're doing everything they can to basically keep treatment in their neighborhood. I mean, between Arlington, Medford, Charlestown, Cambridge, Somerville is the vast, vast majority of all our patients. It's the vast majority. They're all from the neighborhood, and they really want to have their treatment in the neighborhood also. And so, and they're very concerned about being stigmatized. And there's going to be 5% of people who are frankly disruptive. And I'm not making excuses for them. We frankly discharge anyone who is extremely disruptive. We have no tolerance for that whatsoever. I would have to say that they really, really go out of their way to be cooperative. They really have been, I think.
Is this your first location in Cambridge?
Oh, no. We've been in multiple locations. 625 Mass Ave, 675 Mass Ave, 955 Mass Ave. We've been over.
None of those you've identified are residential districts, so.
We've been on Essex Street, which was residential. We were in the St. Mary's Parish building for years, or 54 Essex Street. We were at, we have mental health residences throughout the city. Up until 2 years ago, we had a number of residences in the city, all in residential areas, doing basically group homes for mentally ill patients.
And some of those locations were previously zoned as general office use, the same services that are being offered here. I want to also add, in regard to your question about complaints, that a number of complaints were made to the Department of Public Health by abutters in this area, and the Department of Health investigated and found that they were unable to substantiate any of the complaints against North Charles. And that information has been submitted in the pending litigation in court, and if it's relevant to you, I can also submit that to you. So, in essence, North Charles meets the criteria. This use is not substantially more detrimental than the prior use that was there and provides critical services that are not otherwise available in the community that will benefit the community. So we request the granting of special permit. Thank you.
Questions from members of the board before I go to public testimony? I'm going to open the matter up to public testimony. We do have a number of letters, many of them are quite long. I will try, if I don't read them into the record, I will try to accurately summarize them in a second. And if I don't, and someone will correct me. I ask if you want to speak, and I'll give everyone an opportunity to speak. Let me know if you have a letter, you've written a letter as well, because I will not worry about reading your letter. Okay? I'll go first row first. Sir.
All right, thank you. My name is Ivan Toft. I'm in a butter. I live 15 feet from the facility at 63 Washburn Avenue. I just want to say I appreciate the case that Mr. Houle and his attorney are making, but in my world, I live there. I don't know how many people here in front of me actually live on my street, 15 feet from the facility. But almost every claim that was made and asserted by the attorney here is something that's just contradicted by my experience of just sitting on my porch in the morning. I can talk about the traffic. It's not how many people are in the facility, it's the pattern of traffic. That's the big detriment. People come in a big rush and they leave in a big rush. And this happens, in my experience, and I was actually sitting across the street 15 feet from the facility. In my experience as an abutter, this happens about 3 times a day. It does happen in the morning. First the staff come in. There's a rush as the 30 staffers, or some proportion of the 30 staffers come in. That's not too detrimental. That does happen at 7 a.m. And there are people that honk and school buses that try and go down and a few things. It is a very narrow street, so that's one thing I would say. Then the first rush of patients come in. And this is about 30 cars coming, barreling up a very narrow street where you can only go one at a time. You have to pull over and wait for somebody to go up. They come up.
Roughly what time in the morning do they
That's
come?
about 9 or 10. Their security guard is only there for the first rush. And I just want to stipulate that they mentioned that they have a security guard there and that he was told to be there. If you're looking for a difference in previous use from now, none of the other tenants ever needed a security guard to manage traffic there, right? So, okay, I get that. So this happens 2 or 3 times a day, and then they all leave in a rush. And it's, again, from Newberry Street, it's a hill, one-way street down. People come barreling down that, and then NCI's patients will come out. I also want to stipulate right away and make this very clear. We deeply sympathize with the mission of NCI when we strongly support it, but we passionately disagree that this residential neighborhood in this spot is an appropriate fit for that facility and the services that are provided there. I just want to stipulate that right now. This is not a pogrom against patients. This is not discrimination against people who are really victims in this case. We understand it's a disease. I don't think any of my neighbors are going to get up and say, oh yeah, nobody's going to do that. We all sympathize with those patients. But I've lost 2 family members to addiction. One of them is dead, and one of them is not. My sister has been a recovering addict since she was 9 years old. So if you want to talk about how recovering addicts actually act, not that they're not respectable, wonderful people, but they fall off the wagon. They are recovering. Sometimes they don't recover. My sister has never recovered. She's 52 years old right now. She's never been able to hold a state job. She's been at least 7 treatment programs. So beyond losing family members, I can say that this is a kind of a risky population. I just want to contradict the statement made here. You've got a concentrated population in terms of density rolling up a street who are suffering from a disease they can't control, and sometimes they don't make it, okay? We have seen with our own eyes impaired patients attempting to drive and navigate cars into the lot and almost hit somebody. They were stopped at the last second. We've seen people vomit on the sidewalk. We've seen people, we've seen all this. This is anecdotal, I get that. But then, so are their claims. At the end of the day, unfortunately, you guys have to make a decision on passion on both sides, because we're not going to be able to give you too much empirical data. We're not going to be able to give you too much data. Some of my some of my neighbors will present other bits of this, and I won't present it all. But I will summarize and just end with this and say that there's no question. If they'd started with the special permit and admitted that this was actually a different use from what was already done, we'd all be in the same situation when we're speculating. And Mr. Houle here would be saying, we're going to mitigate all the negative externalities that could arise from our operations there. I will stipulate, cigarette butts dropped dramatically. They've been policing those up great. There's no problem with the lights. As far as we're concerned, all that stuff's kind of irrelevant anyway. The problem is, again, the character of the neighborhood. the balance of the benefits that might be brought by this facility with the very real and up-close detriments which we experience on a daily basis as abutters, okay? Which contradict almost all of the claims made by the attorney. I'll just close with this last thing. In terms of need, benefit, you asked this of the previous case. Is there anyone else that serves that kind of food here? No, this is unique. This could bring a benefit to the neighborhood. Is there anyone else in Cambridge who treats recovering addicts? And I would say yes. And there are. Do they treat them in the way that NCI does? That's a subject for the philosophers, right? But I would just say that in terms of the services that they provide, there are other places in Cambridge that you can find equivalent services. And I bet you that most of them are not zoned in a residential B neighborhood. So I'll let my neighbors and my colleagues and stuff pick up from there. But yes, detriment outweighs any benefit. I don't see many benefits. I see lots of detriments. Hazards as well, just the volume of traffic, the way it's gone down. And I have severe doubts that this could be managed creatively. Mr. Houle may be a really great manager, but some of these negative externalities just can't be dealt with that population in that particular neighborhood in that spot. However creative you are, you're still going to have a hazard, a detriment, and our community's changed. You know, I used to see little kids skating out there. I used to see little kids, learning how to ride their bikes out there. Ours did, right? Old people are now nervous because of the traffic barreling up and down the road. Is that bigotry? I don't think so. That's just evidence. And in fact, I have a video of what a typical in and out looks like that I shot from my balcony on a day. I was just sitting out there having tea with my wife. And we couldn't believe it. We couldn't believe how concentrated this population is and how it all rushes in and all rushes out. If you'd like, you could enter it into evidence, and I could do it some other way. And I could just show you how it contradicts the basic thing. Oh, this isn't different from what was there before. When Gallagher was there, when Thinking Phones was there, all their employees trickled in and then trickled out. And everything was done inside the building. We didn't even know what Thinking Phones was. We just saw the sticker on the door. Oh my gosh. This stuff is not contained inside the building. It rumbles up and down the street on foot. It rumbles up and down the street in the ride, in ambulances, and emergency personnel who are called to the scene when somebody has a problem. None of the other tenants had ambulances showing up 2 or 3 times a month. These guys do.
Can I ask you, because this is important to me, maybe some members of the board, you talk about there's 2 or 3 times a day waves of traffic coming in or out. Describe what time. In the morning you said that when the employees show up 7:30.
Yeah.
That's one wave. Then I think you said, I'm not worried
And Mr.
about
Hull's completely right. From about 10:30 on, it's quiet, the patients are inside.
But
and then after
when
they
does
leave,
the second wave start?
the
Around
second
9?
wave starts around lunchtime, and then there's one in the evening, one in the afternoon, right when everybody's trying to get
There are
home. and pick up
waves
their kids.
other than for the employees before 9 or 10 in the morning. And when the clients show, do they? I think you said they start to show up around 9 o'clock. And go
Yeah, about 10 o'clock. About 10 o'clock, things calm down. The security guard leaves, and then everything's cool for a while. Once they leave, everything's pretty quiet. Then there's another rush about midday of patients coming in, and then there's another rush, as Mr. Houle said, right when everybody's trying to get their kids to and from school. You've got little kids out on the street. You've got Bright Horizons with their little carts of infants going back and forth. And at the same time, you've got NCI's patients in their trucks, in their cars, and everything else. Again, these patients deserve care and deserve help. But this is just not a manageable situation. I mean, it's just not a feasible situation. Sorry, it's dangerous.
Thank you. You're very eloquent in your comments.
Sorry.
No, Monsieur, you get your hand out.
My name is Antje Danielson.
What's the first name?
Antje, A-N-T-J-E.
And the last name?
Danielson, D-A-N-I-E-L-S-O-N.
Now, you submitted a letter, which I'm
I
not
did
going to read.
submit a letter. I wanted to comment on a few points that the attorney made, in addition to my letter. The attorney made the point that Washburn Avenue is located between Mass Avenue and Broadway, and that in those cases there are commercial activities in those areas. The points that I wanted to make was that both Broadway and Massachusetts Avenue have commercial overlays, and the commercial overlay, of course, extends a little bit, I think 2 houses or so, into Washburn Avenue on each side, or on the side of Newbury Street. But there is quite a ways up. I would say that NCI is kind of sort of in the middle of the 2 roads, and so traffic really has to penetrate the residential area. Washburn Avenue, as I mentioned before, is very narrow. Only one car can go one way or the other. From Somerville, from Newbury Street, it's a one-way street down, and Washburn Avenue is back and forth, so you can get in from both sides, but you can only get out on the end of Washburn towards Mass Avenue. The other point that I would like to make is there was some mention of Matanyong and the high school and the traffic that goes up to Matanyong. Point I wanted to make there is if you look at the zoning map, the school on top of the hill, Matanyong, actually also has an educational overlay. So it's not situated in a residential area, it is in a properly zoned area. So, I don't think there is any comparison. Matanyong is also not on Washburn Avenue, it is two streets over. So bringing that in is really, and the traffic that Matanyong generates is really not relevant. And then in addition to, you were interested in the pattern of the traffic, I would say there are two distinct traffic patterns. One is cars coming in, and they often, I think this is my observations, I believe that most group sessions are frequented by people who come in by car. So when there's a group session, it seems to me as if there's 15 to 20 cars coming at the same time and leaving at the same time an hour later. During the day, traffic is mostly by foot, and it is a constant move through Washburn Avenue. And in fact, when I go to work using the T in Davis Square, I can even identify NCI patients on the bike path from Davis Square kind of going towards Mass Avenue. So it's very, very distinct. So that is the last point that I actually would like to make, and that is that the use of NCI is very different from prior use. As Ivan already mentioned, there were two, I own the house, 55 Washburn Avenue, since 1999. It's a two-family. My younger son and I live upstairs. My oldest son lives in the apartment downstairs with his partner. So I've been there for 17 years now. Two companies prior to NCI. One was Gallagher, the other one was Thinking Phones. It was mentioned that Gallagher was bringing in trucks. I don't know what the characterization of the trucks were. The trucks that came into Gallagher were mostly pickup trucks, small pickup trucks. In the entire time that Gallagher was there, I have witnessed once a truck that could actually be called a truck. And otherwise it was, I think they had something to do with electrical supplies, so it was the typical electrician car coming in every once in a while. No comparison to the traffic that's on the road right now. It was also mentioned that Thinking Phone had 80 employees. What I wanted to say is they started off with very few employees, then they grew, and when they reached the limit, they realized that they had outgrown the place and they moved. However, 80 people were never there at the same time. A lot of the employees of Thinking Phones were actually working remotely. It was a high-tech company. People were coming in for short times. They were working remotely. There were never 80 people on the premises at one time. And related to that, I want to make the point that yes, they might only have 30 employees, but as you said, there's 28 treatment rooms in there, and if you have 30 employees times roughly 30, a caseload of 30 people per employee or 30 rooms to treat, you can just imagine what the traffic is like. So I have not sat on my porch counting the people coming in, but I want to say that the traffic pattern is dramatically different, and it really impacts the neighborhood. A neighborhood where neighbors know each other. My neighbors have watched my children when they were growing up. We know each other by name, we talk to each other. It is a very close-knit neighborhood, and this company just changes the character of the neighborhood.
Can you address the parking issue just very briefly? When we moved in, the landlord told us that, well, actually what happened was They had the entire property covered in a black cloth all the way around the property, including, they had the parking lot gated and locked at all times, and they towed cars that parked on weekends and holidays out of the parking lot. We told them to eliminate all the coverings on the fencing. They covered it with this black, this nasty black plastic cloth, and they had a locked gate. We had them remove all of that to open the property up for people to use on the, since we don't use it on the weekends. You know, we don't tow. We've told anyone who's asked, we've told them that they can park, you know, overnight as long as they're out by 7 in the morning. We have no issue with that. Every truck who delivers anything in our neighborhood turns around in the parking lot there, absolutely, because of the fact that the street dead ends, you know, about 50 feet up the street. You know, so I think actually we're trying to benefit the neighborhood by allowing folks more usage of the property than was ever offered before.
Sorry, but wanted to speak.
Thank you. My name is Jeff Melnick. I live at 107 Reed Street in North Cambridge. I've lived in Cambridge since 1988. I've lived in North Cambridge since 1997. I raised 2 children there, including one who's with me tonight. 2 previous speakers both used the key phrase "ignite," so I just really want to support their use of the phrase, the character of the neighborhood. North Cambridge takes care of its own. There are so many of us in North Cambridge who support North Charles. I'm here to speak strongly in support of North Charles getting the special permit so they can continue doing the good work they've been doing. I know you all know about the dimensions of the opiate crisis we're in the middle of right now. I just want to put one number on that I learned from the Boston Globe tonight. In the last 15 years, opiate-related deaths have increased by 360% in Middlesex County. That's our county. That's how many people are dying. That's the rate of increase. The character of our neighborhood says we care more about that than we care about some traffic issues. I appreciate my neighbors' concerns about the quality of life on their block. I've walked up and down Washburn since I first learned about this issue to see how real these concerns are, and frankly, I'm not seeing it. So, you know, Ivan can show you his creepy video as much as he wants. I think it's a little weird to take video of a treatment center. I just want to put that on the record. Obviously, we all want to be a little more concerned about confidentiality and the rights of people who are being treated at this facility. North Cambridge is a wonderful and complicated place. I don't know if any of you live in North Cambridge. I see Councilor Kelly's here, and he'll probably support me in everything I say about the wonderful diversity that characterizes our neighborhood. In some ways, I think about North Cambridge as being bound by 2 schools. One is the Peabody School, and one is Matignon on the other end. The Peabody, up until recently, I don't know if my numbers are right anymore, but up until recently, the Peabody was the most economically and racially diverse school in the state of Massachusetts. Not just in Cambridge, but in the state of Massachusetts. The Matignon School, serving its own community in very important ways, weathered a really, really difficult opiate crisis of its own about 10, 15 years ago. And it came through not because the community rallied around and tried to kick the Matignon out of the neighborhood, but because everybody said there's a problem at the Matignon and we all have to participate in helping be a solution to the problem, making sure that if we see anything going on in the neighborhood that doesn't like it's on the up and up, that we try to help the kids, that we try to support the administration and the efforts they're making. Nobody that I heard in North Cambridge said, let's get rid of Matignon because some of the young people there are facing addiction difficulties. So we stand here today, I stand here today to say we feel the same way about the people who are being treated at North Charles, and I beseech you to think hard about the character of North Cambridge and the character of Cambridge more generally. Thank you.
Thank you.
My name is Judith Smith. I live in the Central Square area. I've been a homeowner on Prospect Street for 43 years. I've raised 3 children there. And I just wanted to say that we've lived comfortably with the residential treatment centers, with the various things that are situated in our neighborhood. It hasn't changed the character of the neighborhood. We felt safe. Our children felt safe. It felt like we lived in a place where there was like caring communities trying to like make Cambridge a better place. That's part of the texture of that Central Square area. So I just wanted to speak to that as like not detrimental to the neighborhood character, but enhancing the caring character of Cambridge by accepting these facilities in with few blocks in both directions, and it not mattering that much. So, my kids are 37, so anyway, lived there for a long time with these facilities.
Thank you. Yes, ma'am, yes.
Thank you. Hi, everyone. My name is Rachel Rubin, R-U-B-I-N, and I live on 107 Reed Street. And I have been very struck lately by reading the Globe by the number of times that the Boston police have said, please take care of the opiate crisis on your own street. And we are disrespecting law enforcement if we say no, don't do what they say. And they have a particular vision of it. They have a view of it that we don't have. And I'd like to quote Lieutenant Detective Patrick Lynn with the Quincy Police Department's Special Investigations Narcotic Unit. He said, these are people who belong to someone. They are someone's son or daughter or father or husband or wife. And I grew up not in Cambridge, in Baltimore, down the street from a treatment center. And when I was little, I asked my mother about it. And I have the world's most Jewish last name, but my mother said to me, because she was Christian, whatsoever you do unto the least of my brethren, you do unto me. And I would like to point out also as a parent, having read and wept over the story of little Bella Bond, whose tiny body was found, and took a long time to identify, that treatment centers affect us all. Not just the people you see going in and out, not just the people you have scorn for. We can't have any more Bella Bonds on our consciences. We need to stand on the right side of history, and I'm a historian, and I can say that is changing. History is changing. There was a time, I think, folks would have hated to have me live on their block because I had epilepsy, right? Now that they would have said I was possessed by the devil or something. We don't say that anymore. And we're not going to be saying this about addiction anymore for much longer, right? But we're at a turning point, and I implore my fellow Cambridge residents to stand on the right side of history.
Thank you. Ma'am, you've already spoken. I'm going to let other people who haven't spoken. Sir?
Yes, my name is Bill Brathwaite, Sr., and I live on Washburn Avenue. I've lived there all my life. And for the gentleman to indicate that because of their benevolence, that the trucks are allowed to use the driveway to turn around, etc., I beg to differ with you, sir. You did not invent that. Trucks have been going in and out of that driveway for over 40 years. So that you didn't start something that was beneficial as far as the area. The trucks have been turning around in there for over 40 years, 50 years for crying out loud.
Thank you, sir. There was yes, ma'am.
Hi, my name's Monica Toft. I'm at 63 Washburn Avenue, and you have a letter, so I'm just going to, you don't have to read it. Ivan and I co-authored a letter. Matt Dignon, we appreciate there was a drug crisis there. The headmaster, Tim Welsh, had written a letter the first time we came here. He's written another letter saying, please do not issue this special permit. The high school does not need drug addiction behavior in the neighborhood. It's already gotten over its crisis. Matt Dignon High School is 250 feet. The international school, K through 8 school, is 500 feet. Bright Horizons, George Sotz's owns that property. They had a drug deal. We have a police record for that. By the way, everything we've said as neighbors, we can document everything. We have all the police reports. It's 400 feet. When I was doing research to find out if this was going to be a good neighbor, I went to the old location and I was told by a guy who came to my house to install gas, he goes, oh, they used to be on Beacon Street. So I went over, he said, you really need to talk to the guy who owns P&K Deli, because the patients used to go to P&K Deli all the time and get their coffee and whatever. So I went in and I had a conversation with this guy for about an hour. He's great, the owner-manager. And after about the end of it, I said, so how are you feeling? You know, you're losing a lot of clients, right? These people, 400 clients coming in on a regular basis, buying a lot of coffee, a lot of cigarettes, and admittedly a lot of lottery tickets. Addictive behavior goes hand in hand. We see them now strewn all over the street. And at the end of the conversation, he said to me, you know what? My blood pressure is much better. I have so much less stress with them gone. He said, I liked some of the characters. I became friends with some of the patients. But I have to say, and this is a businessman. I am a mother of 2 children. Most of these people are mothers or senior citizens. You can go house by house, and we are dominated by families. He was a businessman making money. He has lowered stress. This is a public health issue for our neighborhood. I really hope you respect that. I really hope the board takes that into consideration because we are struggling to deal with this. When this started, you have our original letter, it's from the neighborhood. We tried to find a new location for them, and we did. This institution, this outfit, decided to move into our neighborhood without the proper permitting. This is despite the fact that there were other areas that they could have moved into. 14 Concord Avenue is still available. The landlord is still willing to let them in. He doesn't want methadone on that yet. He doesn't want that. They chose, for whatever reason, to save money and impose the costs on our neighborhood, on our community, on our public services, because they wanted to save money. And now he's telling us he's going to go bankrupt. I'm sorry, should we as a neighborhood, should we as a city have to pay that cost? And with respect to my Reed Street neighbors, Reed Street is a half a mile away. You do not know what we are witnessing. My children are hearing the most vulgar language. I'm a veteran of the U.S. Army. I can take it, but I'm sorry, I'm trying to raise a family. The language is vulgar. Discussion of legal cases, probation, child care, custody, screaming. We have this video. Do you know why we have this video? They were videotaping us. We could not believe it. And the paradox, we'll show you the video, we'll put it into evidence, is one of the clients was trying to get in while somebody from the facility was videotaping me on my private property. And a client yells at them with the most vulgar language, "Get the effing out of the way, what the F are you doing?" My children are standing right there. I'm going to end with that. Thank you.
Thank you. Before I take more comment, are you operating on the premises right now?
Yes,
How long have you been doing that?
since June 9th.
It's June 9th, so 6 months roughly. You've been in business for 6 months. Just out of curiosity, on what basis, since you didn't get any zoning approval to do that?
That's absolutely incorrect. He was given a building permit and a certificate of occupancy as a general office use by
Got
the
it.
commissioner.
And then we just, it was,
And the information was fully disclosed to the commissioner. They came applying as a medical facility, and the commissioner said, no, you need to be general office use. Having reviewed the build-out plan, North Charles invested $300,000 in
I don't
this
wanna go there.
property
I'm
based
not going
on-
there.
You asked if they were properly zoned. They were given a building permit and a certificate of occupancy. It's a nonprofit that has invested tremendous funds in this site. They cannot just pick up and move somewhere else. This will be a death blow to the organization if they are not permitted to continue to operate.
It's a death blow to our neighborhood.
Can I just, one last
you've already
comment?
spoken. I didn't want to let someone else speak, so.
There are at least 6 drug rehab opioid addiction clinics in Cambridge, and there are others in Somerville. You can Google them.
Thank you. All right. There are other, I saw their hands up. I'm not sure I remember where they are. Sir, way in the back, yes.
Okay,
Your name, sir?
my name is Bill Brathwaite Jr., 3739 Washburn Avenue. I've lived there my entire life. The attorney stated that Washburn Avenue runs between Mass Ave and Broadway in Somerville and is perpendicular. That's incorrect. It runs between Mass Ave and Holland Street. Mr. Houle stated that Matignon parents drop off their children on Washburn Avenue. It's 2 streets over, and there is no direct way to get from Matignon High School to Washburn Avenue. The issue about the black plastic around the fence that they found so important that they asked the landlord to tear down, that was installed during the renovation process before these folks occupied. Okay? Now, one of the criteria for approving or denying a special permit is safety and of the residents involved. One of the clients came out a couple of days ago and parked his belongings on the sidewalk in front of my parents' house and was not letting my mother get in and out of her gate. Okay? I've been a city employee for 35 years. The vast majority of those 35 years, 20 and change, were as a member of the rescue company on the fire department in Cambridge. And I've dealt with the addictive population for most of my professional career, and there is, my hat's off to them, all sympathies. I'm a very caring medical professional on the emergent basis. I get to see these folks before they wind up in treatment, and there is no more unpredictable demographic of people in this country or in the world. Yes, it's an addiction, yes, it's a sickness, I bear no one any ill will, but having been punched, kicked, stabbed, spat on, abused, and thrown downstairs trying to extricate or take people back and forth from 240 Albany to Cambridge Hospital, to Shattuck, back and forth to Cambridge Hospital, Mass General. I think I know what I'm talking about when I say that having this influx of folks in and out of Washburn Avenue, day by day by day by day by day, is just a recipe for disaster. All it takes is for one person to have a bad day, have a bad session, or to be hungover and not want to listen to his or her counselor. And when he lashes out, they throw him out of the building. The security guard we've never seen on Washburn. So they're turned loose on a very narrow, long street that's very quiet and full of young families and oldsters. So it's not fair to us to grant the special permit.
Thank you.
Thank you.
Yes, sir.
Shane Steffens, S-T-E-F-F-E-N-S, 81 Yorktown, and I'm a direct abutter.
I'm sorry, what was your address again?
81 Yorktown Street in Somerville, but I'm a direct abutter. Literally in my backyard. And most everything has been said, and we put a letter forward, and it just, I basically want to say that it saddens me that this has become a conversation about addiction in neighborhoods and things like that, when to many people's points, no one is trying to say that these facilities shouldn't exist, and it's just sad that it was put in place sort of unknown to the neighborhood, really, and it seems like there's a lot of things that have happened almost to directly avoid the conflict, to avoid the discussion, and again, that's what zoning is all about, is to have the discussion first and foremost before you invest in terms of renovations and whatnot. So it's sad because it tears neighborhoods apart when that's not what the argument is. The argument is it shouldn't be about whether people should receive care or not or support their neighbors. It should be about the zoning, and there's lots of zoning for different facilities and different things. And so anyway, I just wanted to say that.
Thank you. Mr. Kelly?
Thanks. My name's Craig Kelly. I live at 6 St. George Terrace. I follow up on the zoning issue. It's not a question of the need. There's definitely a need. It's a question of what the rules mean. And as a counselor, I look at the zoning code, and it seems pretty clear that the IUR regulations were specifically designed to protect low-density neighborhoods, such as a Res B, from this sort of institutional use. And then when you look at the special permit criteria, listening to the people that live closest to this use, it sounds incompatible. And if this is something that we want, then it's up to us as the council to change the rules so that we can have this sort of thing in a Res B or a Res A. But it doesn't seem like, from what the neighbors are saying, it meets the special permit criteria. And I'm sad. I think everyone is sad that we're here. But if the zoning is going to mean anything for anyone about anything, sometimes we have to step back and look at those rules. So to me, this is pure and simple a zoning question, and I would argue that it doesn't meet those criteria. Thank you.
Well, I think, let me just, I'm just going to sit down if you like. I just want to just address that. It is a zoning question, but the zoning question is not black and white. That's why we're here tonight. The criteria for what the zoning says is, yes, you can have a facility like theirs in a Res B district. However, you got to get a special permit, and the special permit details various criteria, most of which are not black and white, like safety, hazard, traffic, and it's up to us to look at the facts as best we can and decide whether they satisfy those criteria. So yes, it is a zoning issue, but the zoning issue is not one of measuring how many feet from a setback is. It's more general, subjective decisions we have to make, and we will make them tonight. One last thing, since I had a dialogue with you, I'll let you respond.
Okay, thanks. And I would argue you're entirely correct. The people who are most impacted by this use seem uniform in saying this isn't working for us. And that's where I go back
loud and clear.
If we want to change those rules, then I would suggest the council change the underlying criteria
that you can do, but my only other last point I want to move on is that zoning is not a matter of majority vote. I mean, we make the decision, right or wrong, applying the criteria, and we've listened very carefully to neighbors' comments, because they're the ones that you point out most directly affected. But it's not just a matter of counting noses You're saying, well, more neighbors don't want this and want it, therefore we're going to turn it down. We've got to dig down a little deeper. We're going to try to do that, and we are trying to do that. That's just to respond to your comment. I want to move on now, though. Anyone else wishing to be heard? Wishes to be heard? You, sir? I thought you wanted to speak.
There. I just,
Your name, you give me your name.
Aaron Brathwaite. Lived in 61, 69 years. My community. I've seen rise and fall of a lot of people. I've seen when the factory, the building first was when I was a kid. There were community people who actually lived in the area, who worked in the building. And at that time, they were making little acetate things, pin things, stuff like that. But I see what happens every day. You know, I don't have to be to work until 12, so I see what comes in the morning, and if I'm on my day off, I see what comes in all day. And during the course of that time frame, you have these young kids. Right now, they're in their younger years. When they get to be like 12, 13, 14 years old, and they're in the front yard, they can't not hear what's going on, walking up and down the street. They can't. We used to play in the street when we were kids. Can't do that anymore. We used to be able to leave our doors open. Can't do that anymore. My car was broken into, but it could have been anybody. I witnessed numerous times where people just will go and just sit on the house that's next to them, big white house. It doesn't look like it's lived in, but there is someone living there, and they just sit on their doorstep. Right? This is not my past history. I've been a deputy sheriff down in Virginia, and I lived in a very low-income area. They were trying to revitalize, and I had individuals that were in my custody that had the same problems that North Charles has. I don't think it's a good fit for anybody. I think, if it was on a main street, you don't see people try to come up and down the street. I saw a lady one day walking in the middle of Washburn Avenue, down the middle of the street, not caring of any cars coming by, and she came right out of North Charles. Yesterday, I saw a lady dropping off somebody. North Charles had a person who was doing their snow plowing, plowed a little mound of snow up against near where the fire hydrant was. Well, there was a car coming down the street. She backed up over the snow pile, and she almost hit the car that was in front of her. Then she drops the passenger off, and she goes up Hillbury Street. These are things I see every day. You know, people who live on 8, 9 streets away, they don't have to deal with it every day. You hear what's going on when they come out. You MF, you this, the blah, blah, blah. Little kids don't have to hear that. It was a quiet neighborhood before they moved in. They had perfectly good time to come to the board, ask for a permit to open up at a board meeting like this, invite people from the neighborhood. No. They put flyers in our mailbox. I think one person I know got a flyer to meet them in their parking lot. That was it. Not knowing that there is a junior high school up at the top of Clarendon Avenue. There is a daycare center at the end of the street. There is a Manton High School that's not too far away. And you're putting in people. I go to Dunkin' Donuts every day. I see everything that goes on with their clients. Everything. I observe everything. That was my job, have to observe. So, a lot of stuff, it's in length in my letter, but my thing is no.
Thank you.
Thank you so much.
And thank you to everyone who's taken the time to come down and to speak. No, I'm not, I know, Mr. Brandon, I know he's been waiting to be last. So he's not ready yet, Mr. Brandon. You're off stage still. Ma'am, I saw that hand.
I'll be second to last. My name is Jennifer Brill. I live in Cambridge at 138 Western Ave in Central Square, and I also work at North Charles. There's a lot I could say, but the thing I feel like I have to say most is there's just a lot of assumption and prejudice masquerading as fact. The idea that people here know who our clients are is absurd. I guarantee that there are people walking down the street who you assume are not clients who are, and others who you assume are clients who are not. They don't wear labels. That's all based on your assumption and prejudice of what you think you see. And frankly, our clients have been harassed through this whole process. They know they're being videotaped. They know they're being talked about. I spend a good proportion of therapy sessions talking to clients about how it feels to be so hated by the neighbors. There's a lot of other stuff I could say, but I think that's the most essential.
Ma'am, you haven't spoken, so go ahead.
Very briefly,
Name and address.
my name is Gail Levy. I live at 2 Washburn
Gail,
Terrace.
I'm sorry, Gail what?
Levy, L-E-V-Y.
Okay, thank you. And the address again?
2 Washburn Terrace.
Thank you.
I'm sorry, but you know, when I walked down the street with my 11-year-old granddaughter yesterday, we observed 3 people talking about making a deal and who wanted a $5 bag and some other words that were very familiar to her, but still brought concern.
That's the residents on the street.
No,
That's not the client.
No,
Wait,
it's not.
stop. We're not going to have a dialogue.
No,
on the
I'm
audio.
sorry. I'm a psychiatric clinical nurse specialist, retired. I have worked with a number of people, many of whom were mentally ill and many substance abusers. And I feel that after my 50 years of experience, that I can understand somebody saying, you know, I want to get fucking stoned or I want to buy a big $5 bag. I understand that language. I don't think that people in our neighborhood doubt the importance of people with opiate and other addictions receiving proper human treatment. But if you think walking down Washburn Avenue with all the goings on there is human or confidential, I'm sorry, I argue with you about that.
And breaking into cars.
And passing out.
And leaving an uncapped needle on the street. Maybe there was someone in my neighborhood with diabetes, but you know, most diabetics keep their needles, don't they?
There was
No, the one we
No,
saw.
please, I don't want to have a dialogue.
I'm sorry, I don't mean to argue.
No, I
The
know,
needle
I-
that I saw, the syringe that I saw, once again, I'm a nurse, had no cap on it.
Thank you. Sir, I think you have your hand up.
My name is Maxwell Danielson, D-N-I-E-L-S-S-O-N. I live at 55 Washburn, apartment 1. And I think I'd like to reiterate what you said, that there are a lot of opinions, and I think it really just comes down to experience and what we've experienced and changed, not what we think happened. And there's a lot of subjective opinions about this could be attributed to that or it couldn't be. But just the things that are attributed to the changes that have happened since the company's moved in are traffic and increase in emergency personnel on the street. And I think simply based on those two, regardless of the other things that people have experienced, those have changed the neighborhood. And regardless of any other things that have or haven't happened, those have definitely changed since the city was moved in. So I just want to say that I stand for not approving the special permit.
Thank you. Has a chance to speak? So the roll of drums, Mr. Brennan, you're on.
Thank you, Mr. Chairman. I'm Michael Brandon. I live at 20, B-R-A-N-D-O-N. I live at 27 Seven Pines Avenue, which is about 2 blocks over from the site. I'm the clerk for the North Cambridge Stabilization Committee, and we submitted a memo, so I won't, I'll allowed, or
It'd be
has
better if you
you
could just
to-
summarize the memo for us, I don't have to read it into the record.
Well, you're welcome to summarize it if you'd like. Basically, we support the, and I would encourage any members who haven't seen it to scan it before you make your decision. But basically, we support, on the evidence you've heard tonight, about the specific impacts, and yes, they are somewhat subjective, but you folks know what a hazard is, you know what changes in traffic are, you know what a residential zone is better than most people, and you understand zoning. So we urge you to deny this special permit. We're particularly disturbed that how this all evolved. And then once it became clear to NCI that they were in violation of the zoning and were ordered to stop by Ranjit Singh Anayadan, the Inspectional Services Commissioner, upheld by this board, telling them, stop. Their response was to go and sue the city, and now we're paying to defend this board.
Excuse me, Mr. Britton, I don't think a lawsuit has been filed. I've been
The
advised.
city sought a preliminary injunction. They commenced litigation first against North Charles before Thanksgiving.
Who did, I'm sorry?
The city of Cambridge
city
sued North
sued,
Charles
okay.
to enforce the cease and desist order. A judge has not yet ruled on that preliminary injunction, and there has been a counter lawsuit filed.
Oh, okay, the reason I mentioned that is I was advised, I pursued this, and I was advised by the Special Services Department, or by the city clerk's office, that there was no pending litigation involving this property, so I guess that's wrong.
Well, no, I sort of made the same mistake by checking with the city clerk's office as to whether or not your decision had been appealed.
Right.
In fact, it was appealed in Middlesex Superior Court, and that case, I believe, is also still pending, but they failed to file it with the city clerk as is required, and I have no doubt that based on that appeal of the cease and desist order will be dismissed. Unfortunately, taxpayers and contributors to this nonprofit are funding this litigation, which is ultimately, in my opinion, going to fail.
Okay, well, that's like, okay.
All right.
Okay.
Anyway, that's where that stands. I was going to go through my litany of points contradicting what was said in the application, and I think what you've heard tonight from a very eloquent group of neighbors on both sides makes your decision pretty clear. If you apply those specific criteria, that I don't see how you could possibly, especially while they're in violation and have been for 6 months, accusing people in court of discrimination, and it's not that. People, the opioid crisis affects all of us. I have it in my family. The point is, this is just not the right location, and I would hope that Mr. Houle will reconsider and use his resources in cooperation and with help from the city in trying to find ways for you to move. I think Mr. Rossi would perhaps be able to help with that. Continue your work, but just not here where it's not allowed. Finally, I don't know if you received in time a letter from, email from Representative Dave Rogers.
I don't have the file, Mr. Sullivan.
It's here.
It is? This one is, I know there's a previous one. This one would be from this afternoon. I'll give it to you. If it's not there, I think you'd appreciate it if you just read it in the record. Thank you very much.
Thank you, Mr. Brennan. Okay. I want to say one thing. It's a personal observation. I think there has been a lot of eloquence here tonight, both pro and con in terms of the relief being sought. And this is obviously a very heartfelt issue for the neighborhood. we're involved with something that provides a very valuable service to the community at large. So it's a very difficult, to me, extremely difficult case. But our job, when it comes to special permits, is to basically weigh the pros and the cons and come out with a decision. And that's what we're going to try to do at some point. Anyway, I'm going to close public testimony. We do have an awful lot of letters. I feel an obligation to at least summarize them. And while Tom is looking at the file, I'm going to refer to the record, the letter or email just handed to me by Mr. Brandon from Dave Rogers. And since it's not as long as some of the others, I'm going to read it in its entirety. Mr. Rogers writes, I am writing to oppose the special permit for the above referenced case and respectfully request that the permit be denied. I am the state representative for the 24th Middlesex District, which includes North Cambridge and this neighborhood. But in many respects, I'm writing in my capacity as a resident of North Cambridge, more so than in my official capacity. I live just a couple of blocks away. Our hearts go out to those who suffer from addiction and are seeking treatment. In fact, in my work in the legislature, I have been advocating to increase funding for addiction treatment and have supported other measures to help address this pressing public health challenge. But this location is not at all well suited as a facility for these purposes. In fact, it is my understanding that is in part why the City Inspectional Services Department ordered a cease and desist letter and why that cease and desist action was upheld in a subsequent appeal. It was not zoned for this use for many good reasons. This is a small residential street wholly inappropriate for this facility. The problems arising from the kind of use to which this property is being put are too many to mention, but to say it has been disruptive would be a significant understatement. It just does not work at all in this location, plain and simple. I wish the operator the best in finding a suitable location to carry out its important work, but I respectfully ask that you heed the wishes of the neighbors, respect the residential character of the neighborhood, understand the innumerable problems this facility has caused, and deny the special permit. Let me just make one comment about the earlier case and this notion about what has happened here. Our earlier case was very narrow. The question was, this is a residential district, but it's a legal non-conforming use because there's been a business there for a long time. That legal non-conforming use is restricted to general office. And the petitioner, in this case, in the prior case, challenged that, saying we are general office use, and therefore we fall within the legal non-conforming use. Our board found otherwise. We found the nature of the activities do not fall under the rubric of general business use, therefore it's not permitted. So that was the issue before, and that issue, I guess, may be resolved in the court. Having decided that way, the petitioner, absolutely has a right, to come back and say, okay, for this purposes, I'll assume you're right, Mr. Zoning Board of Appeals, but we do have a right to do it if we get a special permit from you, and please issue us a special permit. And that's what the case is here tonight. I guess I'm trying to avoid it, but I guess I'm going to have to try to dig into the letters, and I'm going to try to summarize it. We have a memo from the North Cambridge Stabilization Committee prepared by Mr. Brandon, and I think you've summarized the points. I don't think I need to get into that. We do have a letter from Dave Rogers. It was dated September 9, 2015. It's been superseded by the letter that I've just read, so I don't think I have to get into that. We have a letter from George Katis, K-A-T-I-S. Stolen River Properties, LLC, 720 Massachusetts Avenue.
He owns Bright Horizons.
Say it again, please.
Bright Horizons, that's his.
Oh, here he owns the Bright Horizons. And he says, I strongly urge the board, wait a minute, this is going back to the September 24th. This is the old case. This is not relevant to where we are. We have an email from Mackie Buck, B-U-C-K, very short. As a close neighbor to Washburn Avenue, she doesn't give her address. Oh yes, Gold Star Road. Gold Star Road, thank you. As a close neighbor to Washburn Avenue, I'm writing in support of the residents on Washburn who feel strongly that this is not a typical or safe use of a building in a residential area. We have a letter from someone in Topsfield, Massachusetts, Jessica Steffens.
It's in relation to 81 Yorktown.
I'm sorry?
It was in relation to 81 Yorktown.
Okay. And it summarizes some of the history of this, and it gets into the notion about they opened this premises up, but made an investment, and then got turned down. The commission said, no, you can't do it. And you had your appeal to us, and we said the commissioner was right. So it doesn't go really to the specific issues we're talking about tonight, so I'm not going to deal with that letter. We have a letter from Martha Older, O-L-D-E-R. I live on Cameron Avenue, which is close to Washburn Avenue. As a psychiatric social worker, I have had addicted clients, and I am very concerned about the general lack of supports for recovering addicts. This is a very important issue, especially with the current opioid addiction and heroin overdose crises. Unfortunately, what I hear about the situation on Washburn due to the substance abuse clinic's presence is therefore doubly upsetting. One, the clients are acting out very inappropriately, upsetting the neighborhood and raising public resistance to such institutions. In fact, they are even jeopardizing public safety, needles on the street, a car broken into, and more. Two, the clinic is being very irresponsible by neither supervising nor by getting clients to behave responsibly themselves. And again, this raises a public resistance to providing much needed help for the addicted. The situation badly needs addressing, and therefore there are many more serious problems. I do hope the Board of Zoning Appeals will take this very unfortunate situation as seriously as it deserves. I'd like to think we are. But the point basically is this is a plea for substance abuse treatments. And I think we've heard testimony from Mr. Houle that they're doing everything that they possibly can to, as I think they are, to try to minimize the impact of the neighborhood on the nature of the business, quote-unquote, business being conducted here. We have a letter from Dr. Danielson, and you've already spoken, Ms. Danielson, so I'm not going to get into that letter. We have the special permit. Oh, no, we have a letter from Megan Watt, W-A-T-T, and William Harnoy, H-A-R-N-O-I-S, 44 Washburn Avenue. Not that long. We are writing as residents of Washburn Avenue, close neighbors of the North Charles Drug Rehabilitation Center, currently operating at 54 Washburn Avenue in Cambridge, in order to strongly oppose granting NCI a special permit to continue operating there. I'm going to skip over parts of it. Again, it goes into, while NCI serves an important purpose, its location on Washburn Avenue, a densely populated residential street in close proximity to two schools and a major daycare facility, is inappropriate for both the residents of Washburn Avenue and the patients of NCI. The arrival of NCI has caused many negative changes to the neighborhood. It goes on to talk about Washburn Avenue being a narrow street, only one car can pass at a time, and there's been ample testimony to that effect. Talks about you employ a security guard. NCI employs a security guard to help manage the incoming and outgoing patients, which is a difference from previous tenants and clear evidence that the facility needs assistance to manage the patients and traffic. Patients arriving on foot and by car have also arrived impaired and have been reported to police. They often trespass, smoke, litter, use foul language, and loiter, something the neighborhood previously did not experience. Residents, particularly children and elderly, are no longer feel safe and comfortable in the neighborhood, often avoiding the area because of unsafe drivers and impaired patients. Several residents of the street have moved to seek new housing as a result. A facility serving a population of recovering drug addicts is important, but locating it in a densely populated residential neighborhood is not only destructive of the neighborhood, but also compromises the patient treatment and privacy. And it goes on to elaborate on that, but I think that says it all. We We have a memo from Monica and Ivan Toth, and you've spoken tonight, so. Same letter, for the one copy, I guess. My goodness. Yeah, copy. We have a letter from William and Barbara Braithwaite, and you've spoken, sir, or you were there, yeah, but you've spoken, so I need to read that. Another letter from Aaron Braithwaite, and then I think the another one.
There's 3 houses of the Braithwaite.
Say it again, please.
3 houses.
3 houses.
Oh, okay. Well, I
I live
single
at
gentleman
61.
spoken to the whole family.
Yeah.
In three houses, so I don't, in the interest of time.
61 is right, I live at 61, so it's directly across the street from my house.
Okay. That's it. Well, I mean, it's in the sense that much of what's been written to us has been said to us verbally, which I appreciate. And again, I compliment people for their involvement in this matter. You don't often get neighbors who would get as active one way or another with regard to a case that we have to hear.
So can I give you a copy of the petition that was signed by all
Sure,
directed
sure,
votes?
sure.
I appreciate your comment.
Thank you.
Thank you.
Okay, I was handed a petition signed by 22 individuals. It says, "We, the undersigned, oppose the petition for a special permit by North Charles and request that the BZA not approve it." And it gets into, again, the deterioration of the neighborhood that has resulted from your moving into the neighborhood. And I think that's been well documented in the comments we've heard tonight. I mean, documented in the sense that that's what people believe, not saying that they proved it. That's the nature of the comments. And that's it for public testimony. I'll give you an opportunity for a final statement before we discuss it among ourselves. You've heard a lot of comments. You may want to address them or you not. It doesn't make a difference. It's up to you. And by the way, after this, no more public, we're going to deliberate among ourselves. We just can't go back and forth for the whole evening. Go ahead, ma'am.
I think the evidence of the services that North Charles provides shows that there is a clear benefit to the community at large. There is often resistance to these types of uses by those who are immediate abutters, and we're sympathetic to that. But North Charles does qualify as either a social service center or other healthcare facility, and we have met the criteria to show that it is not more detrimental than the pre-existing use, that this is a pre-existing non-conforming commercial lot. And many of the comments about traffic and about interactions in the neighborhood, neither party can attribute those directly to the NCI clientele. And so I think some of the comments are well taken, that there are assumptions being made, and that should not figure into the issuance of the special permit. It should be based just on the criteria under the ordinance. Thank you.
Thank you. Well, I'm going to close public testimony. It's now time for a discussion by the board members. Does anyone want to speak first? I'd be happy to, but I'd have to also give the floor to someone else first.
Well, you know, at the end, we can go this way maybe. I mean, I have a great deal of respect for what you do, and I applaud your mission in life. But my purpose here and my responsibility is obviously to take the zoning ordinance that the city council adopts, hands us, and I look at the very purpose of the zoning ordinance and the preamble, 1.30, the purpose of it is to lessen congestion in the streets, and there's a lot of other things that go on. But the key phrase is the protection of residential neighborhoods from incompatible activities. And I think it's incumbent upon me, it's a responsibility of me to adhere to that. And from what I hear, is that the use, the proposed use, is incompatible with the neighborhood. And as much as I respect what you do, I also have to respect the neighbors. And they're asking us to enforce their protection that the ordinance affords. And so consequently, I would not support the special permit.
My comment would be, and it's along the same lines, but take a slightly different tack. The requirement for a special permit is very subjective. And many of the issues that we have to make an affirmative finding on have been spoken to by the neighbors who would tell us it's a completely different result. It says we have to find that the traffic generated by your business will not cause congestion, hazard, or substantial change in established neighborhood character. We've heard, I think, a lot of testimony to the contrary. That the continued operation of or development of adjacent uses as permitted by the ordinance will not be adversely affected by what you're proposing. And we've heard a lot of testimony, and it has not been rebutted, that it will have an adverse effect on the neighborhood. We have to find that no nuisance or hazard will be created to the detriment of the health, safety, and welfare of the citizens of the city. That's a little more broad. I mean, you are going to provide, as Brendan has said, a very valuable service, and every member of the audience has just said, a very valuable service. But there is an issue whether there may be also resulting in nuisance or hazard. To me, that's a little bit of a fuzzy issue for me. I can get over that one. I have a lot of problem with the ones I've said before. And then what you're proposing, will it impair the integrity of the district or adjoining district or otherwise derogate the intent and purpose of this ordinance? And with regard to this, I think Brendan put his finger on it. The ordinance, its purposes says about protecting residential areas. So I have to come out not in favor of granting a special permit. The sad consequence of operating a clinic like yours is you bump up against the NIMBY rules, not in my backyard. And sometimes those are not worthy of listening to. But I think this time they are worthy of listening to. We've had very heartfelt commentary from almost every neighbor on Washburn Avenue. I may have been mistaken, but I think all those comments and support have been people not living on Washburn Avenue, not suffering the day-to-day impact of what is proposed, what is being done here. And you come back to, this may not be the place to run your clinic. Please keep your clinic going, but please find a place that doesn't have the impact that yours has on a densely populated residential district. So as I said, I'm not going to support a special permit.
I have to say that I think this is one of the hardest cases I've ever really settled, and I think most of us would think that too. And I felt that even for people in the neighborhood speaking out with the problems that they've had, that they didn't really lose sight of the seriousness of the work that you're doing, that they were concerned about their neighborhood. I was struck by the fact that people this wasn't a neighborhood who was trying to stop you from moving in. This was a neighborhood who stood up and said, these problems do exist now, and they're hazardous to our neighborhood. So they're not guessing that it's going to be a problem. They really have experienced that it's a problem. So I can't support it.
Does anyone want to comment or not? I want to obligated to.
No, I mean, I think I'd reiterate some of what's been said. I mean, I commend the mission. I commend your commitment and your staffs to the work you do. I think that there was missteps taken in how this led to where we are today, all sitting here with lawsuits. This is not an appropriate location for this. It's unfortunate that it's gotten to where it is. This is a city that's got a diversity of zoning and locations where I think you probably could have found a better space that would have been more suitable than this island within a residential neighborhood. I know that street fairly well, and right up against the Somerville line, that adds a level of complexity in itself. You've got a one-way street, you've got a two-way street that meet. It's one of the few places that I know of that in the city. I mean, it just on the traffic alone, it's problematic, and obviously the overwhelming response we've heard from a city, and I should say a lot of the response are from people who, we've heard from first responders, we've heard from medical professionals, people who have dealt and are familiar with these types of clients that you deal with, and I think that, you know, they're thoughtful comments, and these are people who are looking out for their neighborhood. And yes, there's a citywide need, but the zoning and the special permit criteria talks about neighborhood. This is a neighborhood issue for this particular neighborhood, and it is just not an appropriate fit for this use.
Tom, you want to comment?
Yeah, I mean, my issue is, you know, this can't be the first time that you've heard of these issues. I'm sure wherever you go, you probably run into the same thing. Why wouldn't you have done more, you know, groundwork in terms of meeting with the neighborhood groups and talking about what it is you do and what services you provide before you made a commitment to this site? You know, it seems like, you know, there was an opportunity there that you missed, and you probably certainly would have gotten the message loud and clear and maybe not have made the decision that you made. So, you know, that's the one thing that I think sticks with me is that, you know, these types of issues are definitely not issues that you haven't heard before. And if you had at least opened up the conversation with the neighborhood and the neighbors that live here, you probably would have heard it loud and clear, and you would have found that it wasn't a suitable site.
Thank you, Tom. Well, I'm going to make a motion now, and the way we have to do it is I'll make the motion in the affirmative, i.e. that we grant the relief, citing the reasons why. And then if we grant the relief, fine, but I think you've heard you're not going to, the relief will not be granted. There'll be a second vote as to why we felt the criteria were not satisfied, and why we denied the special permit. So, the chair moves that we make the following findings with regard to the special permit being sought, that the requirements of the ordinance can only be met by obtaining a special permit, since this is a residential zoned area, that what you're proposing will not cause, in terms of traffic generated and patterns of access or egress, will not cause congestion, hazard, or substantial change in established neighborhood character, that the continued operation of or development of adjacent uses as permitted by the ordinance will not be adversely affected by what you're proposing, that no nuisance or hazard will be created to the detriment of the health, safety, and or welfare of the occupant of the proposed use or the citizens of the city, and that the proposed use will not impair the integrity of the district or adjoining district or otherwise derogate the intent and purpose of this ordinance. So on the basis of these findings, the chair moves that we grant the special permit being sought. All those in favor of granting the special permit, please say aye. All those opposed?
Aye.
5 opposed. I'm going to make a further motion. This board moves, and please help me if you want to modify it. This board has made the decision not to grant the special permit on the following basis: that the result of the nature of the activities that will be conducted on these premises, that are being conducted, it does create a substantial change in established neighborhood character, the neighborhood being a densely populated and entirely residential district area, and that not only that, but what will result to the neighborhood will be congestion in terms of the amount of traffic coming in and out, both because of the staff of the North Charles and of their clients. That the continued operation of adjacent uses will be adversely affected by the nature of the proposed use, and we've heard that in many different ways and in very heartfelt ways as to what the impact it's having on this neighborhood. And I think it can be fair to say that nuisance and hazard will be created to the detriment of the health, safety, and welfare of the citizens of the city. Upsetting a long-standing, densely occupied residential district does hurt the citizens of the city, regardless of the nature of the act and the merits of the activities that you're conducting. Again, as you've heard, both from the people who are opposed and from this board, we applaud what you do, and we just can't see it working in this neighborhood. It's just too much evidence to me that this doesn't work, and you will be adversely affecting the neighborhood. And that gets to the last thing I would point out. that what you're proposing will derogate the intent and purpose of this ordinance. And as Brendan has cited, it's clear in our ordinance that one of the goals of this board is to protect residential districts, residential areas. And that's in fact why there's a special permit process. Allows our board to review what you want to do and to make a judgment as to the impact on the city. And I think the judgment we've reached tonight is that the impact is adverse to the extent that we cannot grant relief. So, all those in favor, anyone want to modify or add to what I've just said? All those in favor of the motion I just made, please say aye. Aye. All in favor. Case is over.